Now, there's growing concerns in this county about what some professionals describe as a lack of appropriate behaviour specialist support for families, schools and children's service providers. Two Chartered Behavioural Psychologists, Naomi Powell and Karen Hoey, say many children who are displaying behaviours of concern aren't receiving the specialist input they need early enough, something they believe can have long-term consequences as those young people move into adult services. They're now calling for a stronger, more consistent approach to be put in place, similar to the Positive Behaviour Support model already used in the adult intellectual disability sector under the Health Act of 2007. And Naomi and Karen join me on the line now, and a very good morning to both of you. And maybe to start off, Naomi, you might tell us a little bit about your work as behavioural psychologists and what you're seeing on the ground in Clare.
Okay, yeah, thanks Alan for having us on. So, yeah, indeed. So Karen and I, we're long-standing colleagues actually in the adult intellectual disability sector in a main service provider here in Clare. And we're additionally, so we do that part-time, and we have our own Chartered Behavioural Psychology supports and services called Achieve Behaviour Solutions. And through that, we provide supports to families and to schools. And I suppose for us, we didn't realise, to be honest, because we hadn't given it huge amount of thought. We are years in the adult intellectual disability sector, whereby, as you said, the approach, it's called Positive Behaviour Support. It's evidence-based, internationally recognised, and it's mandated. So if you're working in the adult intellectual disability sector, and an individual may be communicating their needs through engagement in behaviour concern that's high risk behaviour, that's a barrier to them, then that approach is mandated. That approach means an appropriately qualified behaviour specialist must be employed. That person must carry out a comprehensive functional assessment to find out the key factors that are affecting engagement in that behaviour. Positive behaviour support is person-centred, it's rights-based, it means that everybody must collaborate to work together, all disciplines must work together. And it gives, because that approach is mandated, HICWA inspect for it, there's clarity in what we're all meant to be doing. It doesn't mean we do everything correct every time, but we are really clear. Everybody's consistent and clear, but we're not seeing that so if somebody's a school leaver, they're attending the adult services, that's what must happen. But in the services before that, there isn't clarity because this approach is not being mandated.
Okay, and Karen, with the lack of appropriate specialist support, is the issue that there aren't enough qualified professionals available, or is it more about how services are structured, or there are a number of issues feeding into the overall problem?
I think there might be a number of issues. I don't know about the lack of appropriately qualified professionals, but as Naomi is saying, in the adult ID sector, this approach is mandated. So an appropriately qualified behaviour specialist has to be employed. So in other sectors where it's not mandated and the approach isn't clear, that likely may be feeding into it, where maybe there's uncertainty there.
And Naomi, what are the consequences when children don't receive early behaviour specialist support, and how can that impact not just them but the families trying to navigate these challenges on a daily basis?
Yeah, indeed. Well, I think we would have for some time now noticed that, I suppose the services that we're in, we work with everybody from the moment they're leaving school and they're entering our service through the whole lifespan. So we have over the years noticed that some people come into our services where indeed the behaviour might be very, very complex and there might be other issues. But there are other people that maybe come in where we're going, oh gosh, we wish we would have been able to support and advise at a much earlier age, because as time goes on, it becomes trickier, doesn't it? Habits maybe set in, and I think for families as well, they're quite unsure. We've never met a family or a professional who doesn't want to do the right thing, but they're confused. They don't know what the right approach is. There are quite a lot of voices out there saying, well, no, do this or do that, or this should be the way. Whereas when an approach is mandated, it's really clear and everybody knows what they're meant to be aiming towards.
And Karen, both of you also working in adult intellectual disability services. What differences do you see between adult and children's services?
I think it is that there's that clarity, as Naomi was saying, around if there is a behaviour of concern. We have the approach Positive Behaviour Support, in which the framework is there's a comprehensive function assessment carried out to understand the reasons why that behaviour may be occurring. There's good collaboration with other multidisciplinary teams, and it's just that whole collaborative approach to it. I suppose there's more clarity around it. There's a bit more ambiguity, I think, in what maybe the best approach may be, or maybe having, I suppose, all stakeholders coming together may be a factor.
I guess from what both yourself and Karen are saying, Naomi, it's clear, certainly on the face of it, that families and communities in Clare and indeed across the country are being let down by the current system. Is it long overdue that the necessary changes are implemented?
Yes, we feel we can't understand, and we've actually reached out. We're reaching out actually through a local politician at the moment. We're trying to get an answer to the question: how come if a person is 18 and they've entered an adult service, you must use this approach, and this approach must be guided by an appropriately qualified. And just to give you a sense of that, so Karen and I, we have primary degrees in psychology, we have master's degrees in behavioural science, and to be eligible to have even applied for our roles in the adult sector, we had to have had a minimum of 3 years of working as behaviour specialists under clinical supervision to even be eligible. That's what I mean when I'm talking about it. And there are some variations on the exacts of those qualifications, but that's the kind of gravitas. So we're trying to find out, well, why is it you need that to work with somebody who's turned 18? How come you don't need that in the earth, and why is it mandated for that older group and not for the people that we think probably need it even more? Yeah. And in that sense, I feel we're letting people down, but we're reaching out through our politician to try and get an answer on that.
I'm sure, Karen, you'd love to see that, because it sounds like yourself and Naomi spent many years achieving and attaining those impressive educational credentials. You would think that would be sufficient. It must be frustrating to then find out you have to add years of experience to that as well, but then not for the younger age group.
Yeah, and I suppose just that it doesn't seem to be, behaviour specialists don't seem to be on many of the multidisciplinary teams maybe that are supporting children and in children's services in school. And that's another maybe query. We're not quite sure why that is. It doesn't seem to be one of the supports that seems to be available as much as the other or sought out. So I suppose and that maybe again comes back to it not being mandated perhaps, and misunderstanding around the role and what the best approach is to supporting people around behaviours of concern. So I think it all kind of comes back to the same issue. But I suppose in the adult services, because it is clearer, we are seeing that difference between the kind of two sectors.
Just to finish then, Naomi, what role should, I suppose, a number of different stakeholders here, the government, the health services and the education systems, be playing in addressing this issue?
Well, I think the fundamental is to get that. I know I keep repeating myself, but I think the fundamental is to get the positive behaviour support approach that is named in our Health Act since 2007, that is mandated in the adult intellectual disability sector since 2013. That needs to be rolled out in all sectors where support is required around understanding engagement and behaviour of concern and how best to support. That's the first thing that has to happen. And then I'm assuming with that, the ease of maybe getting funds and etc. comes in place. So that's what has to happen. And I suppose for us, it's about we are choosing to reach out through local politicians with the question around why, and please, can you help us achieve that?
Okay, we'll watch with interest to see whether they do manage to assist you on this issue. It sounds like it'd be beneficial, not just for you guys, but for the people you help as well. My thanks to both of you, Naomi Powell and Karen Hoey, Chartered Behavioural Psychologists, with us on Thursday's Morning Focus.